Hello again. Joe just out of here, your friendly neighborhood physical therapist. I am back for another self-help video, instructional if you will. But this time we're going to talk about how to take care of your ankle and your foot. Okay, it's dawned on me that the previous instructions that I've recorded, I've sat down. So my apologies for that, but there's other stuff that we can work on. But today specifically, we're going to work on how to take care of your ankle and your foot. It's the Christmas season, it's the holiday season. People are on their feet a lot of standing and a lot of walking. So a lot of pounding and a lot of wear and tear on your ankles and feet. A lot of parties to attend. You're going to have plantar fasciitis, ankle sprains, wearing those fancy tight shoes, and for the ladies, though I hate to say it, those pointy and high-heeled stilettos. So makes everything sort of stressful, if you will, for the ankle. So maintenance and treatment kind of go hand in hand because the approach is the same. So what kind of symptoms to look out for? Pain, of course, pain in the joint, loss of motion, stiffness, and tissue tightness. All right, your bones cannot move by themselves. So if your bones stop moving, it's because the tissue is no longer pliable; it's become tight. All right. So I'm going to go into the manual aspect of it. I'm going to remove my shoe and my sock. I don't have pretty feet, so I'm going to have to warn you. Okay. And I have a table right behind me, and we're going to work on the soft tissue part first. So what you want to do is you want to take that, okay, just enough to lubricate your skin. So I will take a little bit of this, and yeah, that's good enough. All right, so let's see. Okay, so you should be in a position where you can actually reach for your foot, and I usually start right here, and I'm just feeling simple pressure on my ankle. I'm actually just moving the skin right now. Okay, so where do you actually start? Technically, your leg starts all the way up to there. Your foot. All these muscles move the ankle, so that's your foot. Okay, so technically speaking, I start at the knee and I loosen it up. I'm looking for any type of restriction. When you say restriction, we're referring to tissue not moving, and if the tissue is restricted, it's going to be painful. So we loosen it up, and it's like peeling an onion. You want to go a layer at a time. So what is this quality of restriction that we're looking for? Well, first of all, the tissue doesn't move in the direction where you push or pull it, and it hurts. So two specific things. If it hurts, move it. If it doesn't move, make it move. All right? So we start there. We work on the shin. You can see how I did that with my shin. Okay, we loosen it up. And of course you repeat the same thing on the ankle and then the heel. All right? You can reach for these things. And then for the longer strokes, I want to use my knuckle. I don't want to do that. Like I'm stripping my stockings off. All right, same thing with the outside. There, use every part of your hand. It doesn't have to be difficult. You just have to kind of get a feel for what you're trying to do. All right, so once you loosen this up, this starts to loosen up. And of course you still need to do that. You know, by the time you get to your foot, you want to be able to spread your foot like a deck of cards. You should be able to do that. I know my friend Mike gets grossed out by watching toes wiggle, but you know, your foot is exactly like your hand. You should be able to wiggle your toes. So we have three joints in the ankle. We have the true ankle joint, or the subtalar joint. There's three bones there. This bone, the outside bone, and the talus. And then we have what we call the mid-tarsal joint. All right, you have bones in there just like the middle of your hand. And then you have the toes. All right, so they should all move through full range of motion. This is full range of motion that way. This is full motion this way. Inversion and eversion. You seeing that? Okay, I hope you do. All right, so full motion this way. This is actually how we stretch. There. Hold it for 30 seconds. This way. Like I'm inspecting the bottom of my foot. And then the opposite of that would be this. There is the stretch that you can do where you just place the foot there and you gradually lean over it. All right, see my toes way over my knees way over my toe. And that stretches the heel. All right. You avoid heel cord injuries if you get into these deep stances on a regular basis. I do martial arts, so we're always getting into these deep karate stances. And then you sit. Sit, 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 sit. All right, that's full motion. Okay, so from a manual therapy standpoint, that's how you take care of that. Your bones should also move. You should be able to manipulate your bones to the degree that they can move. You're looking for any restriction again. You should be able to manipulate any of your the joints in your foot without any pain. All right, so that's not a problem. Okay, now you've heard of plantar fasciitis. Plantar fasciitis is the thickening and inflammation of the plantar fascia, the arch. That's a band of tissue that goes from here all the way to your heel and communicates with your calf muscles through your heel cord. Very, very common. Doesn't always require surgery, but the common treatments that we see involve injections, surgery, and sometimes immobilization. That's a lacrosse ball. It's a hard rubber ball. You can easily substitute a tennis ball for this, okay? So we use the lacrosse ball to place the foot on top of that, and we're going to slowly manipulate the foot over and over that ball. So it looks like this. Now ideally you want to do this in standing, but this is close enough. So right on just behind the ball of the foot, and you put pressure on it. Now this is not as painful as standing on it. Alright. So you can see I'm slowly arching, rolling the ball of my foot over that. Now that is painful. That is very painful. Okay. But we consider that abnormal. If it's painful and it's tight, well, that means you got something to work on. So side to side, you can see how my foot's doming and forming around the shape of that ball, and that's what you want. So as the foot rolls over the ball, the tissue starts to stretch. It opens up again, like I said, like a deck of cards. So we're doing this. Also, that's all I'm doing. I'm going side to side. And if you do this for 2 minutes, you would have mobilized the tissue and you would have mobilized the joint for 2 minutes. Should you do 5 minutes? Why not? Should you do 20 minutes? I think that's too much. All right. At the end of the day, that sensation of pain, it's actually not going to change because you're constantly putting pressure on it and you're constantly looking to release tension. All right. So another one involves the long part of the arch, and then we go back and forth this time. Forwards and backwards. Forwards. You gotta be careful when you do this standing because that's going to be a lot of weight committed to that. Forwards and backwards. All right. A simple rule with lacrosse ball rolling is you do not roll over bone. So this is the front of the heel, right there. That's where the plantar fascial tendon is at its densest. So you place that right there. Now I'm going to move my ankle just like so, but slowly. All right. If you go too fast, you're going to miss the little details in there, and most of them are small. There you go. Meaning it's easy to miss. So that's in front of the heel. If I go to the heel, well, there's not much there. There's just fat and bone. So I want to affect the tendon as it inserts into the heel bone, your calcaneus. I'm also going to want to go on the outside edge of my foot here. And I do the same thing, front to back this time. Front to back. Ooh, and that's really touchy on mine. All right. You can do the standing. It's it's a big commitment to stand and create that much pain, endure pain. Sitting, or exactly this position. My Captain Morgan kneeling position. All right. 2 minutes each. And that doesn't hurt as much anymore. All right, so it makes it easier. So what we've accomplished here by doing so is that shape allows your foot to stretch this way. It opens up the tissue. It decompresses the pressure on the tarsal bones. Your foot basically becomes loose. And a normal healthy foot spreads out when you stand. All right, if you look at indigenous people, they really don't walk with footwear. So when they stand, the foot spreads out. So we can see that here. Look. See? It opens up. All right? And that's the problem if you wear shoes all the time. The shoe confines the foot. It squeezes it in such a way that it doesn't get a chance to stretch. This is how you develop neuromas. This is how you develop bunions. This is how you develop all sorts of maladies in your foot. I refer to the shoe as a sensory deprivation foot coffin. That's really bad for you. We weren't born with footwear, so it's okay to be barefoot, folks. So once you're done manipulating and releasing, now you should be able to just fully loosen that up. And now I've done my maintenance for my foot. If you have plantar fasciitis, you just performed a treatment. So I want you to take this information, use it for yourself. Please don't hurt yourself, and do it regularly. Don't wait until you actually have a lot of pain, or you actually have to go see a doctor. This is 100% preventable, if it's not an injury, of course. So check for range of motion, palpate for tissue quality. Is it tight? Is it painful? Work on it. Stretch it, loosen it up, and notice this didn't include strengthening, but that's not the issue here. We're trying to improve mobility. Normal motion is full, and it shouldn't hurt. And if you have those qualities in a good joint, you should be able to move without any restriction or limitation. Okay, so I want you to take a tennis ball, that's a lacrosse ball, and happy hunting.